In the first part of the series, I explained how compression therapy would help in the treatment or accelerate the healing of a venous leg ulcer. However, the question remains, does compression therapy really works? Or is it just something we recommend because everybody else recommends it? Is compression the hero we say it is? Or is it secretly overrated, uncomfortable, and possibly fake news? Patients ask this all the time. Clinicians wonder it too, even if we don't always admit it. And honestly, it's a fair question. Because medicine has plenty of great theories, but a theory isn't enough until it's tested in real patients in real clinics with real outcomes. So today, we are not relying on tradition or habit or because that's what we have always done. We're going into the evidence. What do the trials say? Does compression actually speed healing? Does it reduce swelling? Is that discomfort or the discomfort worth it? And is compression still the gold standard, or are we just wrapping people because it looks therapeutic? By the end of this video, you will know the real story. Whether compression is proven powerful therapy or just a very tight hug that nobody really asked for. Let's find out. So before we continue, let me just tell you that this is part 2 of the series Save a Leg. So if you have not watched part 1, I strongly encourage you to pause this video so that you can watch part 1 first, so that you have a continuous flow of ideas. Now, to begin, why compression exists in the first place? Venous leg ulcers don't start because your skin wakes up one day and decides to give you trouble. They start because your veins get tired of fighting gravity. Picture your veins as employees in a company. The employees are overworked, underappreciated, constantly battling high pressure. Eventually, they start leaking fluid into the tissues and the skin breaks down. So compression comes in like a well-trained manager. It reduces pressure, it supports the calf muscle, it also improves blood flow. So in short, compression is the assistant manager your veins desperately needed. But does it work in real life? Let's see. Let's take a look on the science, okay? The evidence that were pulled from 2020 to 2025. So in a Cochrane review in 2021, this review became the gold standard evidence. So a 2021 Cochrane review, which is basically the world's strictest, most reliable evidence filter, looked at 14 randomized trials with 1,391 patients. And the results were loud and clear. Compression works. So let's break down the numbers. So let's talk about risk ratio. How many more heal with compression? So in this study, the risk ratio for complete healing was 1.77. Let's talk more about risk ratio. So risk ratio tells us how many or how much more likely you are to heal with treatment. So any RR of 1 means no difference. Any RR above 1 means treatment helps. So the risk ratio of 1.77 means patient using compression were 77% more likely to heal completely compared to those without compression. So this is not a small effect, guys. This is a clinically meaningful effect. So let's talk about hazard ratio. How much faster do they heal? So this is all about the healing speed. So the hazard ratio here was 2.17. The hazard ratio tells us how quickly people reach an outcome. In this case, um, healing. So an HR of 1 means same speed, and a hazard ratio above 1 means faster healing. The hazard ratio here is 2.17, which means that at any moment, the compression group was more than twice as likely to be healed. So, in summary, the risk ratio says there are more people heal with compression, and the hazard ratio says they heal faster. So, therefore, this is not a maybe it helps. This is a yes, it really works. So, another evidence here is the meta review in 2023. So the question was, do types of compression matter? So a 2023 meta review by Patton and colleagues looked at 24 systematic review. And the message was refreshingly simple. Most compression systems heal at the similar or heal at similar rates. So it meaning that 4-layer, 2-layer, elastic, and elastic stockings, they all perform well, which is relevant in our time because there are so many type of compressions available in the market today. We have the 4-layer, the 2-layer, the elastic, and the inelastic, and also have a lot of stockings. However, this meta review says that they all perform well. So the brand doesn't matter nearly as much as the pressure, the fit, and the patient's ability to keep it on. So because the best compression in the world is useless if the patient throws it across the room after 10 minutes, right? So the next piece of evidence that we can talk about is the VENOS trial in 2020 to 2023. So the VENOS trial compared high compression bandaging with Unibut. So what's the result? Quality of life improved, the pain decreased, and walking became easier. Even though compression can feel annoying in the beginning, patient consistently reports feeling better once swelling goes down. So it's like wearing new shoes. They feel stiff at first, then suddenly they become your favorite pair. So let's take a look on the 2022 to 2025 guidelines. Compression still reigns supreme. The international guidelines from 2022 through 2025 all agree that compression therapy remains the cornerstone of venous leg ulcer treatment. It is not outdated, it is not optional, it is not just one of the treatments, it is the treatment. And no anti-embolism, TED or the TED stockings are not the same thing as therapeutic compression. So please do not make a mistake. Sometimes I have a patient and then they come to the clinic and they're asking for a TED host. And it's like, what is TED? What would TED host do in your swelling? So a TED host, it's not gonna work. Okay, they are not the same as the therapeutic compression. Remember that. So the TED stockings are for preventing blood clots in the hospital. Compression therapy is for treating disease. So two completely different purposes. There are two different animals, ladies and gentlemen. Now, is this discomfort worth it? So let's address the elephant in the room. Compression doesn't always feel great at the beginning. Yes, it feels tight. But guess what? Tightness means it's actually doing something. If compression feels loose, that's not therapy. That's fashion, correct? Most people feel discomfort for the first 1 to 3 weeks as fluid moves out of the leg. But after that, patient often says, my leg feels lighter. I can walk again. The pain is finally going away. So earlier discomfort means long-term relief. A lot of time when I see patients for the first time, these patients are afflicted with venous ulceration. When I talk about compression therapy, the first question that you would ask is, do we have to start now? I still have this wound. It looks like inflamed, looks like infected. So the question is, when do we start compression therapy? So do we wait until antibiotics are done? Do we wait for the redness to vanish? Or do we wait for the planets to align? Let's answer this based on real science, not based on Facebook medicine. So the evidence is, start compression early, even when there is a mild infection. So the key evidence is that Mosti et al. In 2012 demonstrated that compression improves microcirculation, reduces edema, and does not worsen local infection and venous ulcer. In 2012, yes, on the same year, O'Meara et al. In a Cochrane review demonstrated that compression therapy significantly increases the healing rates compared to no compression, so a delay worsens outcome. Now, let's take a look on the database, like another literature. So according to the European Wound Management Association, they made a compression consensus statement in 2022. So this is very recent. They stated that compression is recommended early, including during treatment of cellulitis, unless necrotizing infection or severe ischemia is present. So this is according to the European Wound Management Association. So yes, start compression early. So the science says early compression equals better healing, faster edema reduction, less inflammation. Waiting does not help. Compression is the treatment. I'm worried that compression may spread infection. Contrary to popular belief, the evidence is that compression does not spread infection. So Mosti et al. In 2012 found no increase in bacterial spread with compression. Instead, microcirculatory improvement helps infection control. Also, allow me to quote the Wound International Best Practice Statement in 2013. So compression does not worsen local infection and may support healing in mild to moderate infection. This is according to the Wound International Principles of Best Practice Compression Therapy, published in 2013. So compression does not turn bacteria into a marathon runners. It actually improves oxygenation and antibiotic delivery, meaning it helps infection resolve. So why compression helps? Reduce edema, or the reduction of edema will improve lymphatic drainage. Improvement of perfusion will result to higher oxygen tension, and also enhance immune cell activity and decongested tissue. If you decongest the limb, you enhance the entry or enhance the penetration of the immune cell, so it increases your immune cell activity. So this is also supported by research in 2015, which is very recent, by Harding K et al. So in the Journal of Wound Care, they have the article says simplifying venous leg ulcer management. So compression is not a victory lap at the end of a healing. Compression is the reason healing happens. So, no, compression does not spread infection. It spreads circulation, it spreads oxygen, it spreads joy to wound care clinicians who love watching ulcers finally close. And according to the multiple studies and major international guidelines, the best time to start compression is as early as safely possible, not after antibiotics, not after perfection, just early with proper vascular assessment and clinical judgment. I hope you are learning something today. If you do, please do not forget to like and subscribe.
after the break.
Alright, I'm pausing the video here so it doesn't get too long. Stay tuned for part 3, where we'll cover the updated contraindications for compression therapy, when not to use it, and clear up the confusion about choosing the right system. With so many options now, it feels like a buffet. I'll break it all down into a simple, evidence-based guide you can use right away. See you in part 3.